All right, let's talk about something that's way more common than you'd think, can be absolutely agonizing, but is often, just brushed aside. Tailbone pain. The medical term is coccydynia, and if you've ever dealt with it, you know it is no laughing matter. So let's get right into it and figure this thing out. So get this, back in the 1950s, doctors actually had a nickname for this, television disease. Seriously. And why? Well, it was because they started seeing a huge spike in cases right when families started gathering around the new TV, slouched on the couch for hours on end. It just goes to show that this issue with prolonged sitting and bad posture, it's not a new problem at all. And while that nickname might sound a little funny, for anyone who's actually suffering from it, coccydynia is a really big deal that can totally mess up your daily life. So what exactly is this condition that for so long has been so tough to diagnose and treat? Okay, let's put a formal name to it. Coccydynia is the medical term for pain right in your tailbone. And I want to be super clear here. This isn't just some random, vague ache. It's a specific, real medical condition. It has identifiable causes, and this is the most important part, it has really effective treatments. Now, here's something that might surprise you. When you look at who gets this, there's a huge difference between men and women. It is 5 times more common in women. And a lot of that comes down to anatomy. The female pelvis is wider. And also the physical stress of childbirth, which can be a major trigger for trauma to the coccyx. So to really understand the pain, you've got to get to know the tailbone itself. And believe it or not, it all starts with a bird. The word coccyx actually comes from the ancient Greek word for cuckoo. Why? Because the very first anatomists who described it thought that this little triangular bone at the very bottom of your spine looked just like a cuckoo's beak. You can kind of see the resemblance, right? It's a tiny little piece of our anatomy, but it plays a huge role. Yeah, the coccyx is not just some useless evolutionary leftover. As you can see right here, it's a critical anchor point for all sorts of ligaments and pelvic floor muscles. In fact, think of it like this. Your tailbone, along with the 2 bones you feel when you sit, your sit bones, they form a tripod, a stable 3-point base that supports you. And when one leg of that tripod is off, the whole system gets wobbly. So, if the coccyx is so important, what actually goes wrong that causes all this pain? All right, let's line up the usual suspects. The number one cause by a long shot is direct trauma. You slip on the ice, you fall down the stairs, and land right on your butt. That accounts for something like 2/3 of all cases, but it's not the only thing. It can also be from the repetitive strain of sitting on a hard chair day after day, the stress of childbirth, obesity, or even just the way your tailbone happens to be shaped. And that last point is a really big deal. It turns out we are not all built the same down there. Researchers have found that there are different common shapes for the coccyx. And if you have one that curves really sharply or juts forward, like you see in types 2, 3, and 4 here, it's just more likely to get pinched and irritated when you sit down. Now, for a long, long time, this is what made coccydynia so frustrating. A patient would be in agony, they'd go get a normal x-ray, and the doctor would say, well, looks perfectly fine to me. Everyone was left totally stumped. But it turns out the problem isn't in a static, still picture. So that's the big question, right? If you're feeling this intense, focused pain every time you sit, but a regular x-ray shows nothing's broken, what's the missing piece of the puzzle? The answer is movement. It's a dynamic problem. The huge breakthrough was when doctors started comparing 2 different x-rays, one taken when the patient is standing up and another taken when they're sitting down in the exact position that causes the pain. And that's when the problem just pops right out. You can actually see the abnormal motion. So let's break down what those dynamic x-rays actually show. A healthy tailbone should flex a little bit when you sit down, somewhere between 5 and 25 degrees. It's like a little shock absorber. The problem comes in 2 flavors. Either you have hypermobility, it's moving too much, more than 25 degrees, meaning it's unstable, or you have hypomobility. It's too rigid and barely moves at all, so it can't absorb any pressure. Both of these can be a major source of pain. Okay, so we know what it is, we know what causes it, and we know how to find it. But now for the most important part. What do you do about it? The great news is there's a very clear, very effective path to getting relief. The whole approach is super logical. You just go step by step. You almost always start with the simple stuff, what we call conservative care. That means using special cushions, working on your posture, maybe taking some anti-inflammatories. If that doesn't do the trick, you move on to manual therapy, like physical therapy. After that, you can try injections. And only for the really rare, stubborn cases that don't respond to anything else is surgery even considered. And here it is. This might be the single most important, most hopeful piece of information in this whole explainer. 90%. That's right. In 9 out of 10 cases, tailbone pain gets better with just that simple, non-surgical conservative care. That is a huge, huge deal. It means this is not some life sentence. It is highly treatable. And since we're on the topic of treatment, let's finish with one super practical tip. A lot of people instinctively reach for one of those donut cushions. But you know what? A U-shaped wedge cushion is actually way better. The reason is simple. That cutout in the back lets your tailbone literally float in the air with zero direct pressure on it. And that is exactly what you need for relief. So what's the big takeaway here? Tailbone pain isn't a mystery, and it's not something you just have to grit your teeth and live with. It has a name, Coccydynia. It has specific, diagnosable causes, usually instability. And most importantly, it has a solution. There's a clear path to getting better. So if this is something you've struggled with, I hope you now know that real answers and real relief are absolutely out there.